Hi, I'm Dr. Jeff Donatello, and we're going to talk today a little bit about our new spinal decompression unit. We're the only ones in southern Maine that have this unit. It's been used all around the country for many, many years, and for some reason it took a little while to get here to Maine, but we have one. And we're very happy to announce that we have one because it works super effectively at helping people with bulging discs, herniated discs, people with sciatica, where the pain is coming from their discs. It helps people with spondylosis or stenosis, where those joints are really clamping down on the nerves. And it just makes a big difference with a lot of joint problems where the disc is being compressed. So what we're going to do is talk to you a little bit today about how we use this machine very differently than a lot of other people use the machine, and how it can really help in your life and take away your pain permanently in many, many situations. So this is called the Spinal Decompression Unit, and Lily has most generously volunteered to be our patient here today. And what you see is a unit that's going to basically take her spine and slowly pull it this way. And if you know anything about discs, you know that they're under a compressive load. And the weight of your body puts pressure on those discs. And when that happens, those discs can bulge or they can break loose. I always compare it to a jelly donut. As weird as that sounds, a jelly donut, if you step on it really hard, the jelly will squirt out. That's a herniation. But if the jelly just bulges out, it can put pressure on those nerve roots. And when it puts pressure on nerve roots, pain will go down the legs, it'll be achy, it'll be aggravating, and it will not go away until you decompress those joints. So what this does is, usually we use about half your body weight, and there's a pulling effect here, going this way, of half your body weight. It'll go for a certain amount of time, and then it'll relax. And what happens is, it'll do that over a cycle of about 20 minutes. And that causes a pumping effect to occur. The disc is 70 to 80% fluid. But if it's under a heavy load, if it's being compressed, then the disc material can't heal. So by taking the disc and allowing pressure to come off of it, and then have it settle, and then come off of it, if you do that over time, it takes all the pressure off the disc, and the disc can rehydrate, and you can get nutrients to the disc, and it can heal. Now the disc and the surrounding nerves, they need fuel, and we use oxygen, and that's what the disc needs. So basically she's on oxygen here too. She's on a cannula hooked up to an oxygen concentrator where she's getting 5 liters a minute. So those nerves and that disc, that cartilage, is getting its fuel that it needs, and it's also being decompressed. The other thing you have to realize is that disc material is made out of what's called type 2 collagen. And type 2 collagen responds very, very well to laser therapy, light therapy. And we have some real high-tech lasers that we use. Not right now. What will happen is we'll go through the 20-minute treatment, and then we put you on laser therapy after. It takes about 90 seconds. So the combination of decompression, laser therapy, and oxygen, the studies show that 85% of people that have this therapy done report feeling better afterwards. Ironically, these same people, they've done studies that they look at the people a year later, and more than 85% do better a year later. So after we decompress you, it takes about 15 to 20 visits over a 2-month period. After we decompress you and we allow that tissue to heal, it actually gets better even when you don't have the treatment. So this is something that is long-lasting and can really make a big difference in your life and allow you to do all those things that you couldn't do before because those spinal discs were continually being compressed. So that's spinal decompression, and I hope you learned a lot today. Thank you.